Addiction is an illness, and like most illnesses, it requires medical treatment and help. Registered nurse and manager at Intermountain Hospital, Allison Heinrichs, explains how medical interventions can put addicts on the road to recovery. Allison, thank you so much for taking the time to talk to me. And I would like to know, as a nurse, what do you think are the most important medical aspects about addiction?
Well, in addiction, the body can become chemically dependent on a substance or substances. And when the person tries to stop using, they can become extremely ill and experience acute withdrawal symptoms. These symptoms can be very uncomfortable, anything from anxiety to tremors, sweating, nausea, vomiting, horrible flu-like symptoms, and they can last from 3 to 5 days. This is a condition that needs to be medically managed, and I want to stress that when it comes to alcohol and benzodiazepines, withdrawal seizures can occur, which can be life-threatening. So please seek medical treatment if you're going to try to stop drinking.
So this is a physical illness that does need medical intervention. And how do you do that at Intermountain Hospital?
At Intermountain Hospital, we have 24-hour care with nurses that are specifically trained in detox and addiction. We also have individualized detox protocols so that we're able to manage the symptoms to keep the patient medically safe and as comfortable as possible while they go through this.
And Allison, what's the most common form of addiction that you treat at your New Start Center for Recovery?
Well, historically, we used to primarily see alcoholism and opiate dependence, but today there's many substances that I would say are used equally. We see alcoholism, opiate dependence, benzodiazepines, methamphetamines, THC, kratom. We call this polysubstance abuse because nowadays patients usually don't just have one drug of choice. And Intermountain is prepared to be able to take care of these complex detox patients.
Allison, have you ever encountered a patient who was uncertain whether or not they wanted to stop using?
Absolutely. After detox, when a patient starts to feel back to normal, severe cravings can begin. And this is where a patient starts to think that they might be able to use their substance and be able to control it this time. That's why I feel it is so important to the long-term sobriety success if a patient continues treatment, whether it be inpatient or outpatient. We have a 28-day program here at Intermountain, and we also have a PHP and an IOP program, whatever meets the needs of the patient the best.
And if someone's watching right now and they're struggling with addiction and they don't know what to do, what do you say to them?
I know that you feel all alone, but you're not. There's a way to do this, but you can't do it alone. There is a huge sober community that is just waiting for you to ask for help. Please ask for help because you are worth it. You deserve to be happy and you can do it.
Allison, where do people go to get that help?
They can go to www.intermountainhospital.com or call our 24-hour intake line. We're waiting for you to call.